Good afternoon, everyone. Thank you, Sana. Um, okay, so let me just uh, share my screen. If you just bear with me 2 seconds. Right. Okay. So, as our country head has mentioned, this is going to be an interactive session on PLAB, specifically focusing on PLAB 1 today. So we'll make a start and we'll try our best to try to incorporate discussion within the session as well as questions. So please, if you have questions, please post them in the chat. We'll try to pick them up. And depending on how things are flowing, we will either proceed with them during the session, or we will have a look at them at the end of the session. Okay, so just confirm, Sana, that you can see my PowerPoint screen?
Yes, Dr. Amar, we can say.
Okay, okay, thank you. Okay, so first of all, just a brief introduction. So just quickly regarding myself. So as you will maybe remember from the short video, I am a clinician with 15 years of experience in the NHS, 10 years as a senior doctor, as a senior GP, and several years experience of examining, teaching undergraduate medical students for a UK medical school, which involved many years of OSCE instructing and examining, which is obviously a key part of PLAB, PLAB 2 specifically. What are the aims of today? Okay, so first of all, we are going to get an overview of PLAB 1. We will discuss some key bits of advice and techniques, mostly based on my experience as an examiner. And we will go through the main sections, the main kind of points that we had mentioned in the video, such as tips and tricks, a brief discussion about hot topics and what does it mean to be a hot topic. Then we will discuss the importance of certain evidence-based resources, and then we will practice some questions together. Okay. Just briefly, some housekeeping. Obviously, if the session is becoming very interactive and everyone has time, then we will continue as long as we need. There's no such thing as stupid questions. So please, if you don't ask, you don't learn. So please just feel free to ask whatever you like in the chat box, and we'll do our best to answer them. And if there's something I don't know, then we will get back to you. And there's no shame. One of the key points of being a self-aware and a conscious clinician is knowing the limits of your knowledge. So if there's something we don't know, there's no shame in admitting it. And the important thing is to stay within your competence and your boundaries, and find out what it is you need to know and then continue. So there is certainly no shame in that, either for you guys or myself. Okay, so as you guys probably already know, PLAB is currently made up of two parts, PLAB 1 and PLAB 2. PLAB 1, of course, is a multiple choice single best answer exam, which is 3 hours long and consists of 180 questions. So you have, on average, exactly 1 minute per question. PLAB 2 is an OSCE style examination, and we will discuss that in detail in future sessions. By the way, I'm running the class fully in English because, of course, you guys are interested in moving to the UK, and This is a English exam. So although मैं Urdu और Punjabi में भी fully fluent हूँ, this is going to be a fully English session. So I hope that's okay. Okay, so just briefly, I wanted to mention about the foundation year program. Obviously, as clinicians, graduates, and doctors from Pakistan, you may not be fully aware of the training program system in the UK. So if you can see the slide in front of you, the key points are the center bits of the slide, which are FY1 and FY2. These are foundation years. Previously, many years ago, they used to be the same as I think what you guys do in Pakistan, which is a house job. But in the UK, quite a long time ago, this was changed to 2 years of basic junior doctor training. So the entry to FY1 and FY2, as you can see through the slide, comes from either medical school in the UK, or through once you have completed your internship or your house job in Pakistan. And then, of course, FY2, in FY1, you are only provisionally registered with the GMC. You are fully supervised, and you are not classed as an independent doctor. Once you move into FY2, this is when you are fully registered with the GMC. And after this year, you can then proceed to specialty training. We will discuss the importance of the level of PLAB in relation to FY1 and FY2 shortly. After foundation training, as you can see, obviously, after 2 years of foundation year training, you can decide to specialize into either primary care medicine, which in the UK is called general practice, or you can continue into secondary care medicine. And the lengths of the training schemes are different, but they are both classed as specialists and they have separate training schemes in the UK. The one for general practice in primary care is shorter than most of the secondary care specialities. Okay, so first of all, I wanted to talk about some key points on preparation and exam preparation. So as you can see at the top of the slide, I've written fail to prepare, prepare to fail. PLAB 1 is a knowledge-based exam. So of course, it is multiple choice, it is single best answer, but it is a knowledge-based exam and you cannot do well on the examination unless you have a good grasp of the requirements of the curriculum as stated by the GMC. And we'll go into that a little bit more later on. Success is 99% perspiration, 1% inspiration. This is my experience both through studies, undergraduate years, and then also through clinical training programs. There's no getting around the fact that you need to work hard. But of course, you guys are motivated. That's why you are here, and we're here to help you. So revision is absolutely crucial. Of course, as we've mentioned, this is a knowledge-based exam, but there are also certain things that you cannot revise for. Now, these are the things that we, our academy, specifically myself and our other academic faculty members, will be able to be particularly helpful for you guys with. I'm sorry, you just had to mute somebody there. So yes, there are certain things that you can revise for, and in my experience, doctors coming from the subcontinent, from Pakistan, India, and from most parts of the world are pretty good at their knowledge of basic science, clinical medicine, etc. That all that stuff is very, very good. But there are certain things that to succeed in the UK, these need to be ingrained, and they are quite difficult to pick up from in books. They're quite difficult to revise for, but you can learn about them, you can read about them, and you can start to ingrain them in your thinking and your professional practice. And we will look at these in detail in the future, but we'll touch on them briefly today. So, of course, I'm speaking here about things like professional values, ethics, how the regulators in the UK see the duties of a doctor and how a doctor should conduct themselves, and what are the roles and responsibilities of a clinician in the UK. So these things come with familiarization, with understanding, not memorization. But the more you come across them and the more you try to understand them and practice them, they will become more natural to you. So I don't know if anybody has ever heard of the PDSA cycle. This is something quite well known in academic circles and in change management. So PDSA stands for Plan, Do, Study, Act. And this cycle can be applied to any kind of process, whether it be a clinical protocol, whether it be an administrative process, or whether it be revision. So Plan, Do, Study, Act. In relation to examinations, I would change that slightly to plan, revise, practice, and analyze. Now, what that means is, obviously, we are a couple of months away from the next PLAB 1 sitting. Now, I'm not sure if how many of you guys are intending to sit PLAB 1 in November or in February or even beyond that. It does not matter. The key part, first of all, is to plan your preparation. So planning incorporates understanding the resources that you need, the resources that are key. Of course, you already have lots and lots of knowledge. You know, you've all been through medical school, you've all been through, some of you will have been through house job, some of you will be even much more senior than that. So the knowledge is not an issue. But what you have to do is you have to adapt and refine your knowledge so that it comes into line with UK norms and UK protocols and UK procedures. So you need to, and we will help you with this, you need to do lots of planning with regards to how you are going to tackle the vast amount of subjects that you need to have a look at to revise for PLAB. So that's the first thing. Revise, it speaks for itself. You know, there's no getting around the fact that you need to study. The next one is practice. Questions, practice questions, practice. The more you practice MCQ and single best answer, the better you will get at picking up key points in the question and understanding that actually most of the time, a lot of the answers could be correct, but the key about single best answer is that there is exactly what it means. There is one answer that is above the rest. And the final part of this cycle is analyzing. Now, analyzing means looking at your performance. So assessing how you have done in questions, how you have done in your preparation and your revision, and trying to highlight your weak areas. There's no point going over areas that you are strong in. There's no point re-looking at things that you are already very competent in. Looking at weak areas and without trying to you know, diminish your guys' experience and your skills. The key point is refining your knowledge to become to make it in line with knowledge that is suitable for practice in the UK. So that centers around the evidence-based resources, which we will come to shortly. Now, of course, if if you are planning on sitting in November, it's not too far away. 2 months, I can't remember the date exactly, but 2 months is still quite a significant amount of time. So if you use your time well and with our support, inshallah, I'm sure you can still do particularly well. So all is not lost if you are yet to start anything. Okay, so the key body in PLAB is the GMC, the General Medical Council. The General Medical Council are the regulators of doctors in the UK. They register us, they tell us how to behave, and they monitor us, and of course, they license us. So what does PLAB 1 test? Well, the key point is trying to understand what the GMC wants from you. That is the most key point in PLAB. So first of all, the GMC says that PLAB covers common, important, and acute conditions. Now, I've yet to, sorry, I haven't been looking at the chat so far. Okay, can anyone please give me a definition of what common means, what important means, and what acute means? Feel free to, Sana, are they able to unmute themselves?
Yeah, they are able to unmute themselves, और आप उसके अलावा chat में भी answer कर सकते हैं.
Okay, if anyone feels confident, please go ahead and have a go at what does it mean to be what does common mean, what does important mean, and what does acute mean?
Hello, I am Dr. Tuba.
Ji, Dr.
Yes,
Tuba.
Dr. Tuba, we can hear you.
Okay, so I want to answer the question.
Please.
Okay, acute is immediate onset, means the history of symptoms is less than 1 week, and common is the kind of patients you usually see in your OPD.
Very good.
I think common is more frequent cases you actually
Yes.
see in your OPD.
Yes. Okay.
And acute is immediate onset or history of less than 1 or 2 weeks. This is acute.
Okay. And what does it mean?
Acute may not necessarily be common.
Correct. Yes. And what does it mean for an important condition? What is an important condition?
The red flags, I guess, in any conditions are important.
Okay.
Or the sticking points or the diagnostic points, I guess.
Okay. Okay. Excellent. Thank you very much, Dr. Toba.
Yeah.
Okay. So, very kindly volunteered by Dr. Toba there. So, these three specific terms, Dr. Toba is sorry, I realized I was just talking on mute. Thank you, Dr. Toba. So very kindly volunteered answers there from Dr. Toba and very well answered. Thank you very much. In relation to the GMC though, what the GMC are interested in when it comes to common, important and acute conditions are the following. So common conditions are things that you will see either in primary care, so in general practice, or in the outpatient departments. And these are conditions that obviously affect the population widely. Important conditions are things that the GMC are very, very interested in the fact that you should be extremely competent in dealing with important conditions, not just because they are common, but because they are, as rightly mentioned by Dr. Toba, but because they are potentially either very widely affecting the population or very serious in their nature. And acute are conditions that you will most commonly see presenting to emergency departments or accident and emergencies. Or they can turn up in any clinical situation. They can turn up in your general practice, they can turn up in outpatients, but generally they're focusing in relation to the exam, they are focusing on conditions that present to the emergency department. And that's how they will highlight these conditions to you in a question. So what level does the GMC say that PLAB is testing? So the GMC says that PLAB is at a level appropriate to the beginning of foundation year 2. Foundation year 2, if you remember, as we went through in one of the first slides, is the second year of your junior doctor training in the UK after you have completed your provisional registration. So it is quite a basic basic level of knowledge, but of course it's slightly above undergraduate in the sense that you will have some clinical experience. Okay, so what should you use to prepare? Now, there are so many things I could mention here, but first of all, the two things I would like you to take a look at before you, if you haven't done so already, or before you look at anything else, is the PLAB blueprint. This is a document which has been published by the GMC, and it is basically a syllabus. It's very, very extensive. It's very comprehensive. It's quite clunky to use, as they only allow you to download it in an Excel format. But it's really something that you need to look at, because it just lists absolutely everything that they could potentially examine you on. So lots of topics, lots of conditions, even what you are expected to know specific to them conditions. So you do need to spend some time familiarizing yourself with that. The second thing is the foundation year program curriculum. Now, this is a slightly different document. This is less like a syllabus. It's more like a kind of outline of what is expected of a foundation year doctor. There is some coverage of knowledge in there, but it's more in relation to skills, behaviors, and attitudes. And these three things are absolutely key in everything the GMC is interested in. Now, there are 4 main domains of the syllabus. I can see someone has raised their hand. I don't know if that's the first time. I'm happy to take a question.
Dr. Iftikhar raised the hand.
Yes, please go ahead, Dr.
Yes, you can unmute your mic.
Are you there? Okay, no problem. It was a mistake.
It was a
No
mistake.
worries. No problem.
Assalamu alaikum, Dr. Umar.
Walaikum salam.
There is a question. There is any age limit to give PLAB? Please, can you answer that?
As far as I am aware, there is no age limit. Sana, are you aware of anything?
Yes, there is no age limit, Dr. Umar.
Yes, that's correct. Yeah.
There is no age limit.
You must have to be a medical graduate from the recognized university. You have to complete your IELTS or OET, and then you can appear for PLAB. There is no age limit. आप कभी भी दे सकते हैं.
Thank you. Okay. So just coming back to the 4 main domains of the syllabus, and I want you guys to try to understand how this might feel very different to what you guys are used to in Pakistan. Obviously, I have no training or I did not go through medical school in Pakistan. I was born and bred in the UK. All my education and medical school and everything was in the UK. The only clinical experience I had in Pakistan was doing an elective in Shaukat Khanum Memorial Cancer Hospital in Lahore. But it was quite a long time ago. But the 4 main domains of the syllabus first are knowledge, skills, and performance. Second is safety and quality. Third is communication, partnership, and teamwork. And fourth is maintaining trust. So as you can see, I am guessing, and I would be quite confident in guessing that this is probably quite different to what you guys are used to and what you guys have perhaps been exposed to so far. So knowledge, skills, and performance is only a quarter of the syllabus, which is set by the GMC in relation to PLAB and in relation to foundation year doctors. The 3/4 of it is safety and quality, communication, partnership, and teamwork, and maintaining trust. So that just gives you an idea of how the focus might feel quite different in UK exams. Okay, so just quickly, a little bit more about PLAB 1. So this exam is more about application of knowledge versus regurgitation of knowledge. So it is your ability to apply your knowledge and your clinical experience to a scenario rather than just testing your recall. And this is very much the case for all levels of medical examinations and qualifications in the UK, all the way from undergraduate all the way through to the very senior postgraduate ones.
Dr. Umar, sorry for interrupting. There is a question. Dr. Iftikhar wants to ask something. Yes, Dr.
Sure.
Iftikhar, you can go ahead. Ask your queries, please.
Is my voice loud and clear?
Yes, we can hear you.
I wanted to ask, is there any limit to how many times you can give your PLAB?
Okay. I cannot remember off the top of my head. I think there is a limit to the number of times that you can sit the PLAB. But if you just bear with us, we'll just find that out for you and just get it back and pop it in the chat box if that's okay. Thank you. So this examination is focused around current best practice. So the key is not to this is what I was talking about earlier about refining and kind of realigning your knowledge to which is more in line with the UK protocols. So it is.
Dr. Umar.
Ji.
Sorry for interrupting. The answer is if you have failed the PLAB 1, you can maximum give the 4 attempts.
Yes, that's correct. Thank you, Sana.
Thank you.
Okay, so current best practice, evidence-based medicine in the UK and in fact in all of the Western world. It is all about evidence-based guidelines. So I will tell you about the resources in a couple of slides. The drugs that you will be asked about, that will be mentioned, that will be talked about in PLAB 1, all of the drugs are in the British National Formulary, and there will be nothing there that is outside of the British National Formularies. This is just another key point in relation to familiarizing yourself with UK-based drugs, in particular the generic names. In the UK, the convention is to use the drug names and not the brand names. And the final point is you need to have some kind of an awareness of what kind of equipment is available in UK hospitals in routine kind of scenarios. This will not be too dissimilar from what is available in Pakistan, but you know, there may be some slight variations. Okay, so single best answer. Okay. So as I've already mentioned briefly, single best answer is multiple choice. However, there are usually, most of the time in PLAB, it is 5 options. And the four other options can be distracting. They can also be correct, but single best answer is the most correct. So you may come across a question that that seems like, you know, it's very difficult to decide because a lot of the options seem correct, but what you have to do is get good at deciding which is the most correct one. And the questions will be a scenario or a statement followed by a question and 5 options. So this seems a very silly thing to say, but you have to read the question properly. That is the most key point of answering PLAB questions. And in fact, if it'd probably be useful for you to get into a habit of highlighting or underlining specific key points in the question itself. Okay, Sana, could you just mute everyone, please? Unless someone's got a question.
Yes, sir. No, we have not got any question till now. I'm replying in chat.
Yeah, no, I just people keep coming on to. Okay, it's okay. No problem.
We just got a question from Dr. Saima Yasser. She's asking that minimum how much months required to prepare a PLAB 1, and after clearing the PLAB 1, can we get the job there or necessary to pass the PLAB 2?
Okay, so how much time you need really depends on what I've tried to highlight in the first part of the presentation, which is how familiar you are with UK-based guidelines and protocols and procedures. I would say, for if you are coming into this with zero knowledge of UK-based practice, but a reasonable knowledge base or a decent knowledge base based on what is required in Pakistan, then if you are starting from the absolute zero, I would say you need a good 6 months. However, if you already have some familiarization, if you already have some exposure, or you've already keep in touch with things, or have had a look at things because of previous interest, or just because you have come across things, then you may be able to do the preparation in less time than that. So 2-3 months may be enough. Passing PLAB 2 on its own is not enough to be considered for licensing in the UK. You need to you need to pass PLAB 1 and PLAB 2. So today we are just focusing on PLAB 1, and in a future session we will focus on PLAB 2, but you need to pass both. I hope that answers the question.
Thank you, Dr. Umar.
Thank you. Okay, so the key point I wanted to mention is don't spend too much time ruminating over what you think the question is asking you. Read the question fairly quickly, but highlight the key points, and then go with what your initial instinct is. Don't try to overthink the question. If you are really struggling, I would mark it and then come back to it at the end. But do not leave any questions unanswered. Do not leave any questions, any options unhighlighted, because obviously, even if you just have a pure guess, you still have a chance of getting it correct. Questions most of the time will ask for what is the single most likely diagnosis in this scenario, or what is the most appropriate next management step, or what is the most appropriate next investigation. These are the common kind of scenarios. Okay, and just remember that you have, on average, 1 minute per question. Okay, so the PLAB blueprint. I did just want to highlight the link here, and I want to, in fact, what I will do is I will paste it in the chat box for you. So I'm just doing that now. I'm not
Dr.
sure.
Umar,
Yes.
for moving to this, we have a question.
Yes, please.
The question is GMC Minds, if you have 3-year post-graduation gap.
A good question. I don't think the GMC minds, as long as you have proof of what you have done in that 3-year gap. In particular, obviously, they're not interested. You know, if you wanted to take out a gap of 3 years or 1 year or 2 years because you wanted to go and travel, or you wanted to have children, or you wanted to do, you know, anything else, that's okay. But what the GMC are interested in is how you kept up to date. So that's not only your knowledge, but it's also your skills. So you have to bear that in mind. So the answer to the question is not necessarily, as long as you can show evidence of continuing CPD, and as long as you can show evidence of keeping up to date and keeping your skills up to date, the GMC won't necessarily view that negatively. If, however, you haven't kept up to date, then it may be viewed negatively, yes. I hope that answers the question.
Thank you, Dr.
You're welcome. Okay, so I've posted the PLAB blueprint link in the chat box. You know, do click on it and do have a look in your own time, and you will be able to see how detailed this document is, how it is really quite remarkable how they have gone to the lengths of listing every single topic and subject and condition that they may possibly test you on. And you will be able to see there are a number of tabs running from you know, diagnosis, investigation, management, and then also all the other things that we mentioned in relation to professionalism, teamwork, etc. So that is the PLAB blueprint.
Okay,
Okay.
Dr. Umar, this is Dr.
Okay,
Tuba
yes.
again, and I want to ask another question.
Yes,
Can
please
I?
go ahead, Dr. Tuba.
Okay.
Sure.
I'm particularly asking about myself, as I am a graduate. I'm a very old graduate. I'm a graduate of 2005. I've done my graduation from Law Medical College, Karachi, and after graduation, I haven't practiced much. See, I have a long gaps of 5 years. I have graduated in 2005 and did my house job in 2006, and I have done a general practice here in Pakistan in 2009 and 10, and then I had take a break of good 5 years, and then I have done another GP practice here again in Pakistan for 1 year, and then again I have a gap of 5 years, and I'm practicing right now. Meanwhile, I've tried to study family medicine, and I'm trying to cope up with my clinical skills, and I'm trying to improving my skills and knowledge as well. So is it wise to give a PLAB 1 at this stage, as I am 40 now, and I'm willing to do it, but what is your suggestion, and will it be possible for me to get a job over there or practice?
Okay, so
That's it.
yes, thank you. So hopefully the answer to this question may be relevant to other people also. The first thing I would mention is what I did just before, and that is in relation to keeping up to date. If you have kept up to date, regardless of the length of the gap, then there is no reason why you cannot attempt to sit PLAB, and there is no reason why you cannot attempt to obtain licensing in the UK. That's the first thing. The second thing is 2005 is not that long ago. I graduated in 2006, so you are my age. So don't worry about that. The third thing is that this is, you know, all is, don't lose hope. You know, we're here to help you, and we're here to help everyone through their individual scenarios. I would not discourage anybody at all from trying to re-enter medicine or clinical medicine after a gap, or I would not discourage anybody from trying to sit PLAB examinations or to further your career in any way whatsoever. This is because there is no, as we mentioned, there is no upper age limit to PLAB. And I myself, throughout my career, have known personally many doctors who took long gaps. So I knew somebody who was out of clinical medicine due to ill health totally for 10 years. 10 years, no exposure to medicine or clinical medicine whatsoever. But there are mechanisms, even in the UK, through the GMC, for these kind of clinicians and colleagues to re-enter clinical medicine, to enter into a supervised clinical post, into a fellowship type of rotation, take an exam and get re-registered on the medical register. So please don't lose hope based on how long ago you feel you practiced medicine or your age or anything like that. Everything is possible and nothing is impossible. Just over the coming days and weeks, just stay in touch with our team, and we will put together a program of suggestions for you in how to kind of maximize your chances. I hope that answers the question.
Thank you, Dr. Umar. Actually, I am not losing hope, but I don't want to have false hope as well. So I just asked this. I have already discussed this with Sana, but for my satisfaction, I have asked you this question. Plus, definitely there is a lot of difference practicing here in Pakistan, and the guidelines are totally different for UK. As I am giving a overview, I'm having an overview of this PLAB syllabus that you have shared already with us. So definitely the things are very different. We are practicing in Pakistan with a different vision, and the guidelines that should be followed in UK is totally different. So
yes, So
if somebody can, is it possible that we can prepare it in 4 months, or how much time one should give to the study? Please guide on this as well.
Yes, so as I mentioned just a few minutes ago, it's possible to, I would say a comprehensive preparation from zero would be around 6 months. However, it can be done in a shorter time period, and everybody is different. Doctor, my dear colleague, I did not mean to suggest that you are losing hope, but I just wanted to reiterate to you that you should not lose hope, and that everything is possible. I mentioned the example of somebody who left clinical medicine for 10 years totally, and they came back into medicine and now re-practicing fully as a GP. So there is no scenario where you should write yourself off. Just please stay in touch with us. Tell us your issues and your individual requirements, and we are here to help you.
Could I just add a few things, Dr. Umar?
Thank you.
Add a few things? I have a few questions.
Yes, please.
Can everybody hear me? Yeah, I completely agree with Dr. Umar. There is no age limit, and either you are 40 years old or you are 80 years old. I know some of the doctors who have passed their PLAB in their 70s because of the better opportunities, better training, and everything. For the preparation, as Dr. Umar mentioned, you need 4 to 6 months. And about the things, the difference between the practice in Pakistan and here, there we come to help you and support you throughout your process. We will guide you from step 1 to step N till you get the job, and even afterwards, post-PLAB will help you. So this is where we are to support and guide you fully. So there's nothing to worry. Either you are 41 years old or you are 80 years old. Just get, because while you 10 years, you will practice here, pass here, and you will be better trained, you will be better doctor, and better, financially, you will be better as well. Like, I'll give you a simple example. If you pass your PLAB in that stage where you can join it, and after a few years, you will be earning almost £100 per hour, which will never happen in anywhere in the world, that you could make, financially, you'll be stable, career-wise, you'll be stable, and it is best for your entire family as well. So hope this answers. If there's any confusion or anything, just remember to pass your PLAB, you need English test, either IELTS or OET. You should be a graduate from any recognized medical university. There is nothing else could stop you. And if any problem, Hive will help you from day one till you get the job and you're working here. Thank you.
So much. Actually, I wanted to hear such good words from you guys. That is why I've asked this question. As sometimes, yes, we do lose hope, and we want to hear some good words from our colleagues so that we'll buck up. Thank you
No
so
need
much,
to worry,
Dr.
Azhar.
Amar.
That's why we are here. So, any questions, anything, we will hold your hand throughout your journey. That's why
Thank
we're
you
here.
so much.
And
Thank you.
Dr. Umar is very experienced. You could hear he is giving you such a comprehensive plan. And this is how we
Yes,
guide the people. Because in Pakistan, I would say that there is so much myths and misunderstandings and misconceptions about that, we can't pass PLAB, we can't take, we have not got a house job. House job is not your requirement. Nothing. You are a graduate, contact us and speak up. The most important thing is the communication. If you don't speak, and especially when it is coming from Harsh's mouth, like, I'm in the system, I'm the consultant for last 20 years, I'm in the NHS, we have been involved in the recruitment, Dr. Omar has been involved in recruitment and training. So we know exactly, and we will give you the correct information rather than you're getting information from the Google, somebody sitting there who has not worked in the system. So we are here to help you.
Thank you.
Assalamu alaikum, Dr. Shakil. Thank you for joining us. Sir, there is a question of Dr. Saqib Saeed Khan. I have been out of clinical practice for many, many years after MBBS. What are the prospects for us? Could you please answer him?
Yes, sure. There are 200% prospects. Same for you, for anybody who is a fresh graduate, either from the UK or outside. Right? It does not matter, because what we do, here I said, our role comes. What we do, we review your CV, we clear and cover your gaps as per GMC guidelines. That's why you need professional academy like us and the people like Dr. Umar and myself and our team, where we guide you and we prepare your CV, we cover your gaps according to GMC guidelines. So there is no question at all. And if you don't get the professional advice, you try to do that. I will give you one example of one of the doctor who had some gaps. He did not seek any professional advice. And he sent the CV with the gaps to the GMC. GMC rejected his CV. So you could understand the importance of the professional advice from the seniors or professional people so that your gaps are covered. I previous 6 months before, one of the doctor, he's 65 years old. He had 15 years of gap. We reviewed his CV. We had a couple of Zoom meetings. We went through all his activities and everything, and we covered his 15 years gap as per GMC guidelines, and he was happily accepted by the GMC. He passed his PLAB. He's working as locum consultant. So these are the examples from the real life we're giving you. So whatever gap you have got does not matter, but always get the professional advice, professional support, so you are not being rejected and you are not wasting your money by failing or repeating your exam again and again.
Thank you,
Thank you, sir,
Shakil.
for your response. There is one more question. Can I give PLAB 1 immediately after my graduation before house job?
Yes, definitely. As far as you have, I will give you one example. In India, what people do, because from India, every year, 20,000 doctors, they come. From Pakistan, there are minimum doctors coming because they don't have proper guidance and support or anything. So what they do in India, when they're in final year, they start preparing their English test and PLAB 1. So the day they pass, they get the results, they book their PLAB 1, they start here foundation program. To say they don't do house job or anything in their country, they come here, they start from the foundation, and within 7 years they become consultant. So they are saving their money, they're saving their time and speeding up everything. So if you're in final year, if you're in the house job, have you done the house job or not, you can register with us. We will help you, it will be more helpful for you. Soon as you come here, you'll join the program, you will be on the track for the training and you'll be making money as well. So again, I will say, to pass the PLAB, the basic requirements. Does not matter how old you are, does not matter either your house job or not. Have you got the MBBS degree from recognized medical college? You have passed your English test? That's it. You can appear in your PLAB 1. Once you have passed your PLAB 1, we'll book you for your PLAB 2. Once you have done your PLAB 2, you'll apply for the registration, and then you're ready to start working. Depending if you're fresh graduate, you can apply for foundation program. And if you are senior, you can apply for FI2 or SHO post. There's so many jobs. These days, there's so much strikes going on. Even the fresh graduates, you are just starting house job. Imagine they are getting jobs for £100 per hour. This is the situation. So the people who really want to make a difference in their career, their life, and their family's life, they should take this step. They should pass their PLAB. They should join us, and then come to for the better training and better life. Hope it answers everything.
Thank you so much, sir.
Thank you so much.
There's one more question. Dr. Mahad is asking. Hello.
Yeah, I'm listening. Sorry,
Yes,
Dr.
yes.
Omar, I'm interrupting. I'm taking.
It's okay, no problem. No problem. Continue.
Thank you, Dr. Umar. Dr. Mahad is asking, is house job enough in terms of medical experience for PLAB for Pakistani graduates?
So sorry, could you repeat it? Sorry, I couldn't hear.
Sir, he is asking, is house job enough in terms of medical experience for PLAB for Pakistani graduates?
You don't need any experience. If you have got it, well and good. Whatever you have done, either you have worked 1 year or 10 years, it's not going to bother. GMC not going to bother. It's not going to count. So if you have got experience or not, no. As far as you have got, just remember. Nothing else you need to take PLAB.
Sir, thank you so much, sir. There is one more question. Saima is
Okay.
asking how we can manage to book PLAB as there is a very short, limited seats.
Yeah, the PLAB 1 days, there GMC, because there's a shortage of the doctors, the PLAB 1 days, they are introducing almost 30,000 more seats, right? Because we are working closely with GMC, so we know the thing. So we know the rest, and we help all our candidates. Once they register with us, they will be getting account. GMC will help them to create GMC account, and rest is everything is online. They could make appointments and booking from online, and we'll guide them step by step.
Okay.
One more thing I want to ask Dr. Umar.
Thank you. Can I just, thank you, Dr. Shakil. Dr. Shakil is our CEO at Hive. So very, very experienced and much more the expert in the process.
Dr. Umar, sorry for interrupting. There are so many questions. What would you suggest? Should you end the whole presentation, then we will answer them, or?
Yes.
Yes,
Let's do that.
They will take all the question at the end of the session, inshallah.
All right.
So I will leave you with Dr. Umar. Dr. Umar, please.
Because otherwise,
sorry for. Thank you so much.
No problem. It's okay. Right. So yes, please don't worry. We'll answer all the questions. We are not going to go until everybody is satisfied. So let's continue. So we mentioned about the GMC PLAB blueprint. Also, I mentioned about the foundation program curriculum. I will also post the link for this in the chat here. So obviously, there are many questions, and we can perhaps go through these documents in detail in a future session. But for now, I will post the links, and you can have a look at them yourself. If somebody is unmuted, please can you mute, because there's a lot of interference. Thank you. Okay. Right. So foundation program curriculum. Right. Okay. Now, this is what we're speaking about in relation to evidence-based resources. And some of the doctors, our friends who have asked the questions, and they've highlighted differences. And I have also in between practice in Pakistan or anywhere else in the world and practice in the UK. So what you have to do is you have to build on what you already know and supplement it with UK appropriate knowledge. So that's knowledge of drugs, protocols, guidelines, and conventions. So for primary care conditions, and a lot of the PLAB questions, well, not a lot, but a fair chunk of the PLAB questions will be about primary care conditions. and a fair chunk of them will also be about secondary care, and a fair amount of them will be about emergency medicine. So all of these are important, and we cannot highlight one above the other. For primary care conditions, clinical knowledge summaries are the best. And sorry, I was talking while muted again. Okay, so clinical knowledge summaries. This is best for primary care conditions, and I will post all these links in the chat box again, so you guys can have a look at these. NICE guidelines in general, so that's clinical knowledge summaries is separate from NICE guidance. Clinical knowledge summaries are best for primary care conditions. NICE guidance covers everything else. And then the British National Formulary, or the BNF, as it's commonly called, covers all drugs, all licensed drugs and medications that are used in the UK. So it's very, very important that you have a look at these, familiarize yourself with the sites, how to navigate them, and how to search for things on them before you actually start to use them to prepare. Now I've put something here saying what came first, the chicken or the egg. What I'm talking about here is whether you actually need to know the specific detailed clinical knowledge about a condition before you actually review the guidance for the condition. Now, what I'm going to suggest here might be slightly controversial, but you will understand once you look at these resources. If, for example, you don't know anything about how to manage, diabetes in the UK. Obviously, you know about diabetes in general, you know about how to assess, diagnose a patient, and you may know some management techniques, etc. But you will not know how things are done in the UK. So you do not need to go back to your original resources that you used to learn about diabetes. You've learned that now, so you don't need to go back in this particular scenario, just using diabetes as an example. So you can go straight to the egg, which is the clinical knowledge summaries a page on diabetes. And believe me, when you look at this, you will see that with your previously acquired knowledge from medical school, this will be a perfectly appropriate level for you to understand how you go about assessing, managing, diagnosing, and treating somebody with diabetes in the UK. Okay, sorry, I keep clicking in the wrong place. Okay, so the next slide, I want you guys to do a little bit of work here.
Excuse me, Dr. Omar.
Yes, please.
Sorry for interrupting you here. We have our respected client with us, Dr. Shahid. He wanted to add some feedback about the Hive services. Dr. Shahid, can you hear me, please? Dr. Shahid, can you hear me? Hello, Dr. Shahid, can you hear me?
Please don't waste time.
Yes,
Dr. Omar, you can continue. I think there is some distortion at Dr.
yes, we can come back to Dr. Shahid afterwards. Okay, guys, so let's work through a quick scenario. So hypertension. So you have a 56-year-old male who is found to have raised blood pressure readings at a routine NHS health check, or it may be in your outpatient department, or it may be anywhere else in the clinical landscape. So can somebody very, very briefly, very quickly tell me what you would do in Pakistan, and then we will compare that to what we would do in the UK in terms of managing this person with hypertension. Anybody, please unmute yourself and give us a quick 1 minute summary of how you would proceed.
Okay, can I answer, Dr. Omar?
Yes, please go ahead.
Okay, so first of all, there are certain stages of hypertension. So you have to first evaluate what is the stage of the person. Is it pre-hypertension, stage 1, 2, or 3? So during stage 1, you have to evaluate, is it hypertension or is it a white coat hypertension? So in stage 1 or pre-hypertension, we have to evaluate whether the patient is hypertensive or not. So we usually have a check on whether it is the hypertension. So we give home-based blood pressure monitoring or ambulatory blood pressure monitoring. We do this. And if the patient is in stage 2, means the blood pressure is more than 140 systolic and more than 90 diastolic. So we have to, again, we have to confirm our reading, whether it is whether the patient needs to have antihypertensive medications or just the
Please add diet and
so if the patient comes in hypertensive, if the blood pressure is more than 180 systolic and more than 110 diastolic, there are two conditions: hypertensive emergencies or hypertensive urgency. So if the patient presents to us with hypertensive emergency, like raised blood pressure along with end organ damage, whether it is headache, papilledema, kidney failure, heart failure, whatever, then we'll go for immediate pharmacological treatment. Will lower the BP within hours with IME treatment. And if it is not hypertensive emergency, it's only the raised blood pressure without end organ damage, then we'll give oral medicine and we'll lower the blood pressure over the.
Okay. Okay. Thank you. Thank you. I think it was Dr. Toba. So that was a very detailed, very comprehensive answer to the question, which is brilliant. Now, in the UK, what we would do is, first of all, if there's a suggestion of raised blood pressure readings, straight away, and if you have a look at the CKS page on hypertension, you will see that, first of all, we have to determine if, as you correctly mentioned, if this is actually genuine hypertension or not. And what you do is, if there's ambulatory blood pressure machines available, you set that up for the patient, and then you go ahead and you wait for them readings. If they are not available, and in some places they may not be available, you do what are called home-based blood pressure readings, where the patient is instructed how to correctly take their blood pressure. You provide them with a machine, automated machine, and you ask them to take twice a day blood pressure when completely relaxed after 30 minutes of doing nothing. Obviously, during that time period, you have about 2 weeks before they will come back to you. During that time, you obtain an ECG, you do basic bloods, full blood count, USANEs, LFTs, lipids, HbA1c, etc., to complete the risk assessment. And depending on the readings that they come back with, you then have a full picture of the patient and how to proceed. And in the UK, the first line drugs could be an ACE inhibitor, could be a beta blocker, could be a diuretic, it could be a calcium channel blocker, depending on the ethnicity of the patient, depending on their comorbidities, and depending on anything you find in the blood test, for example, their baseline renal function, etc. So this scenario, these kind of scenarios will be exactly highlighted and exactly mapped out for you in clinical knowledge summaries. I cannot I cannot reiterate to you enough how excellent and how important clinical knowledge summaries are. Look at common conditions, hypertension, diabetes, primary care conditions in particular, because in the UK, in the NHS, in primary care is where we manage chronic conditions, obviously that are not, that do not require specialist input. So, okay. So, very, very briefly, you will see lots of people mentioning hot topics. What is a hot topic? I was speaking about this to someone last night. I was doing some research, and look, there is nothing that you will find. If anybody tells you that these days the GMC are testing X, Y, Z, these days the GMC are focusing on this, that, and the other, it's simply not true. There are lists of hundreds of presentations and conditions. How do we decide what is hot and what is not? The GMC decides what is important, what is common, what's acute. These are the three things I've mentioned to you, the three key conditions, types of conditions that you are required to focus on. Okay, so basically, familiarize yourself with the PLAB blueprint, familiarize yourself with the foundation year curriculum, and start to get used to navigating clinical knowledge summaries, NICE guidance, and the BNF. That is the perfect way to start your preparation. Okay, just before we move on to some mock questions, which is the final part of the presentation, I believe we have Dr. Shakil, who's tried, not Dr. Shakil, the other doctor colleague who is tried to give us some feedback. So he's back now. So we will go ahead with him. Please go ahead, Sana.
Thank you so much, Dr. Omar. Hello, Dr. Shahid. Thank you so much for your time. We will be very grateful that you have joined us. Guys, he is Dr. Shahid, and he have joined Hive Medical Academy. He just wanted to give the feedback कि उनका कैसा experience है, हमारी कैसे services रही हैं, and अभी तक जो PLAB की preparation कर रहे थे, वो उनकी कैसी journey जा रही है. So please welcome Dr. Shahid and go ahead.
Assalamu alaikum. Can you please hear me?
Yes, Dr. Shahid.
Walaikum salam. Yes, doctor, please.
Yeah, my name is Dr. Shahid. I'm actually a kind of old type of doctor, all in the sense that I graduated more than 20 years ago in 2000. I've been practicing medicine in Pakistan for last 12 to 13 years. Before that, I was working in China. I completed my MD in cardiology from China over there on government scholarship. I've been back in Pakistan for, as I told you, around 12 and 13 years. It's been fun working with all the team in Hive Academy. Miss Amna, sorry, I forgot the names again. And Sir Shakil, he's been quite helpful and kind and always willing to help on all the questions I had. I had a lot of questions like all the colleagues here that I've been in the practice for so many years. I graduated a long time ago, and would it be wise and advisable to go and try and pass PLAB and go and work in the UK? I had a lot of questions, a lot of concerns, a lot of hesitation, but with the help of Miss Amna and the team of Hive Medical Academy in Pakistan and UK, I got registered first in GMC and then started preparing. I use a lot of resources actually. Because of limited time, I basically not really a lot of resources, but I mean a number of resources. Most important for me is the video lectures from Aurora Medical Training Company, which is a partner of Hive Medical Academy. Then I have the videos and audios, and then mock test as well. It's been fun working with all the resources and all the people in Hive Medical Academy. I know it takes time, especially when you have been working in government job, and then I have 3 clinics based on the cardiology experience. So I don't have too much time for preparation on daily basis. Sometimes in a week, I just don't get a minute to work on my PLAB studies, but sometimes I get a couple of hours. So depending on my personal experience, I thought it's been really fun. Preparation is going okay. I originally planned to take the exam in November, but I think it might be quite difficult, quite enthusiastic actually, because I haven't done my OET yet. So most probably I'll go for February exam, and after that I'm quite confident that, considering the type of material I have for preparation, then I won't have much difficulty, hopefully, passing the exam. And once I'm there, hopefully Mr. Sir Shkil and his team also will help with the PLAB 2 preparation as well. And then most important for all of us is placement in UK NHS for work, because we are looking for better life quality than what we are experiencing currently in Pakistan. Future, our own future, our kids' future, life quality. That's what we are looking for. So that's the story. If anybody has any question, please ask me. I'll answer to my best of my knowledge. Hello? Hello?
Dr. Shahid, there is a question, but I think so it is for Dr. Umar. We can answer after the end of this session. And thank you so much, Dr. Shahid, for your kind response and for your time. We wish you good luck for your whole PLAB journey, and we are there for in case of any query and any needs. Thank you so much.
I'm glad I could find this chance to speak to everybody. Thank you.
Thank you, Dr. Shahid. Okay, we have another feedback. She is also our client, and her name is Dr. Sania. Please, Mahanur, could you please unmute her so that she can speak? Hello, Dr. Sania, are you there?
Can you hear me?
Yes, we can hear you.
Hello, hi. Good afternoon, everyone. Hello.
Good afternoon, Dr. Sania.
Yes, Dr. Sania, we can hear you. Good afternoon. Hope you are doing well.
We can hear you. Continue.
Yeah, I'm well, thank you. I'm just here to give my feedback and my journey to taking PLAB and moving to UK. Actually, I was planning to take PLAB exam for some time, and I was looking and obviously searching for material online and everything. And one day I just came across Hive Medical Academy. So they had contact number on their website. So I contacted the team member in Islamabad. And then they straight away forward me to Dr. Malik in UK. And since then, I've just been, they've given me some material to actually revise and getting me ready for PLAB. It's been absolutely pleasure learning from them. They had really, really good resources, really good material. I've never seen anything like that online or anything like that. I was so happy that I've joined HMA. They always helped. If I was stuck, I will just pick up a phone and call any team member, and they will answer my query. And I was really satisfied the way they dealt with me, and they answered all my query on time. And they supported me really well. If anybody has any question, they can ask me. And one thing I want to mention, that their passing rate is really good. It's about, I think, between 90 and 96%. So if any of you guys, if you want to join, please do join them, because you don't want to waste your time and money. And their packages are so good. The package price is really, really, I would say, cheap. They're not ripping you off or anything. They're charging what they're really supposed to charge you, and it's just brilliant. I would highly recommend. That's all I want to say. If somebody wants to ask me anything, they can. And all of their team members are either GPs or PLAB examiners and consultants. So you're not really hello?
Hello, Dr. Sanya, can you hear us?
Hello?
Hello, Hive team, can you hear us?
Yes, we can hear you both.
I think there is an issue, connection issue.
Thank you so much, Dr. Sania. We are really honored to have your feedback with us. And we are hoping that you will recommend to others too for a good academy. Dr. Omar, you can continue now. Thank you so much.
Excuse me, Sana and Dr. Umar, can I ask a question?
Yeah, sure.
Actually, Sana, sorry to interrupt this session. I am actually on my job now. So I wanted to leave, but before leaving, I want to ask just one more question. As I have already joined your course, so just one last question from Dr. Umar or from you, anybody who can answer my question.
Please go ahead.
Okay, I just wanted to ask, as I have already joined this PLAB 1 course, and I have received video modules from Aurora Medical Education, and I have gone through a little bit. I have taken an overview of this course, but I just wanted to ask that, do we have any face-to-face classes or guidelines, and how would I suppose I have gone through all of these things, and I wanted to give PLAB in February. So, what else you will do to facilitate me? Do we have? How would I get to know that I have done? How I have prepared well for the exam? What are the next steps?
Okay, I will answer that,
getting...
Dr. Umar. I will answer
yes,
that.
Please.
Yeah, thank you. All right, you know, when you registered and you have got the email where you have got all the resources and your proper plan, all the schedule. You have got 7 mock tests. How many mock tests you have done? Have you completed any of the mock tests? Hello?
Oh, sorry, my mic was mute. Dr. Shil,
Dr. Malik, have you completed any of the mock tests yet?
Yes, I have completed 1 mock test, and I just did that test to evaluate myself, where I am standing. So before starting the study, I have just tried one of the mock tests, and it was a very bad score that I've got.
Yeah.
So, but I have just started to study this whole course. So I have taken an overview. I have gone through a few of the flashcards. I just wanted to take the overview, what the course is all about, what you have given me. Good. I have started watching the videos as audios, whatever you have given. But let's say I have gone through all of it, all the videos and audios and these flashcards, and then how would we interact? How would you get to know that I have prepared well, or do we have any face-to-face classes? And what is the next step after going through?
Yes, I'm telling you. Yeah, this is first thing. You don't need to just have the overview. This is the comprehensive material which you need to read properly. with the proper schedule. Secondly, your live
Right.
classes in your account, there are the dates available whenever you want to attend, because we give full freedom and
Okay.
flexibility to all
I
candidates.
have checked my
Yeah.
email, but
No, no, not email.
but
In your
I
account.
don't
No, it
get
is in your account.
those dates.
Yeah,
Okay.
it is your accounts, and you can change the dates and everything. That's
In my account.
completely
Okay.
flexible.
Okay.
Yeah. You need to log into your account and check your live classes dates, and you can change and set dates as you want, because we give full freedom and
Okay.
flexibility. Second thing, you need to, as I think I spoke to you before, you need to set a schedule. How many hours every day you want to do it, and you need to divide your topics. Like you have done the first mock test, and that's very good. I'm glad you did it. That gave you idea where you stand.
Okay.
Now you need to decide. One day you keep that, okay, I
Right.
want to complete this week my video course, right? You need to watch all video topics
Right.
and make notes from there,
Right.
right? Then next week you can keep the,
Right.
this week I'm going to do the audio course and complete your audio. And third week you do another mock test. Then compare your
Okay.
first mock test and second mock test, right? And where you stand. In between,
Right.
whatever the questions or anything, you have got Dr. myself, you have got Dr. Aman, you have got Dr. Pooja. Anything, any topic you want to discuss, just give us a shout. Because this is the aim of the things, giving you so much resources and comprehensive material so that you assess yourself and then you discuss with us so that we could assess you where you stand and we could improve your chances of passing the exam. And your interactive class, when you will have the face-to-face class, that will again go through and ask you, okay, you had the material, tell us, what are your weak points?
Yes,
What are your
right.
weak subjects? Then we'll take you through.
Okay.
And most importantly, these live classes we will continue.
Oh.
We will have every fortnightly or every month, these live classes will be going on. This will give you an extra opportunity, free of cost, where you can share that, you have discussed this topic and this is your weak topic. Like, you say that, okay, cardiovascular is, I'm struggling. So I need some more tips and tricks to revise it. So this is another extra opportunity for you. So this is simple and straightforward. Organize yourself, right? Make a schedule, do things one by one, and move forward. Yeah.
Okay, thank you, sir. Thank you so much, everyone.
Perfect.
It's very nice talking to you guys, and I really get more insight of this exam, and everything is much more clear now. As I'm on my workplace now, I had to leave, and I am looking forward to talk to you more about this PLAB in future. Inshallah.
Yeah, sure. That's why the aim of the Hive, we are here to hold your hand from the day one and take you throughout your journey. And even after post PLAB, we provide all services. We help you to get job. We do your CV. We help you to do all the courses, because those are very, very important that you do those courses, get local references, clinical attachments. Otherwise, it will be very hard to get shortlisted. Yeah.
Okay, thank you
so much, Dr.
Shakil and Dr.
Sir,
Kumar.
there is one more question. Dr. Saad is asking, are the maximum number of PLAB 1 attempts still limited to 4 attempts?
Yes, 4 attempts. Yeah.
All right.
Yeah. 4 attempts, you have to pass in 4 attempts. But majority of our candidates, they pass in first attempt. Because the way you train, where you prepare them, and what material they have got. We have got very comprehensive material, content, up-to-date questions. And especially our tutors, they are ex-PLAB examiners, they are GPs, they are consultants, and they have decades of experience. So obviously, when you will be studying with or getting training from the doctors or people who are in the system, the chances of passing the exam is much more. Especially for the PLAB 2, we train them to the top standards, so they could compete in the interview in the PLAB 2 and OSCE for the local graduates as well.
All right. Dr. Saad, if you have any question, you can unmute your mic and ask if you are in session.
Well, I have a question. Can I ask?
Yes,
yeah, sure.
Please go ahead.
Sir, actually, there is a test UKMLE. It's rumored around that it will take place in the near upcoming years. What are the chances of this exam, UKMLE? Please throw some light on it.
Yeah, I will throw full light. Don't worry. That's why we were about to explain at the end. UKMLE is UK Medical Licensing Exam, right? There was a consultation going on since last 6 years. They have done good research and consultations, and they're planning to launch it in next year, 2024. So what's UKMLE? UKMLE is PLAB will be replaced with the UKMLE. So PLAB name will be changed. Its name will be UKMLE. There will be 2 parts. Part 1 will be AKT, Applied Knowledge Test, which is PLAB 1, right? Your PLAB 2 will be replaced with CPSA, Clinical and Professional Skills Assessment. And other thing, this UKMLA exam, every single person who wants to work and settle in the UK, they have to take it. Before, PLAB was only for the overseas graduates. Now the local graduates, British graduates from the local university, they also have to take the UKMLA before they get the GMC registration, start working. So this is very good because it is equal. All the overseas and local graduates are equal. And secondly, is it will be more important that, you know, the overseas graduates, they need to prepare well to compete the local graduates. So this is again here our role comes to prepare you as per standards of the local graduates, local education, so that you could pass your UKMLA as well. So GMC has not announced any confirmed date yet or any confirmed course line for the UKMLA as yet, but probably they are planning to launch in January. So, but it would not affect anyone who is taking PLAB or not. If you have taken your PLAB, in case they start launching, so anybody who has taken PLAB 1 in 2023 and they have passed PLAB 1 in the 2024, if UKML is there, they will take part 2 CPSA, not the PLAB 2. If nobody has taken any PLAB 1 in the 2023 and they want to take 2024, that will be AKT. That's the PLAB 1. So main difference, name will be changed because there will be unique thing and equal for everyone, local and overseas. And there will be course name PLAB 1 will be replaced with AKT, PLAB 2 will be CPSA. No other difference. And there's no confirmed course lines or confirmed details of the date when they want to launch it. Hope it answers your question or anything else.
Thank you, sir.
No worries. Any other questions? Anybody?
Yes, I want to ask a question.
Yeah, go on, please.
Okay, I want to ask that who is eligible for PLAB 1? Like the fresh graduates should give the PLAB exam, or those who want to shift to UK for the job purpose or for the post graduation, like who is eligible for PLAB exam?
Okay, eligibility and who wants, they're two different things. Eligibility, I will say that anybody who has got a medical degree from a recognized medical college, right?
Okay.
Who could pass English test, IELTS or OET, they are eligible to pass PLAB 1 and PLAB 2, and then GMC registration start work. Other thing that who wants, anybody who wants better training, better career, better money, better life, they could do it. Simple.
Okay.
So there is no, if best way is if you are fresh graduate.
Okay. If like I have done my post graduation, I have done my FCPS, and I am now working as a consultant, and I have experience of like 12 years as a consultant working. But I am asking that if I want to shift to UK, even then I have to give this PLAB exam and I can go, or there is something other like specialist pathway or something like this.
FCPS is not recognized by GMC, so it does not matter. 10 years before, your anesthesia and radiology, there are 2 degrees where were exemption from the PLAB. But now, because of the credibility issues and other things, none of the Pakistani degree is exempted or accepted or recognized by the GMC or Royal College of Physicians and Surgeons. So either you have done FCPS, you have done PhD, or you have worked 10 years or 20 years, that's not going to matter. You need to take the PLAB. Yes, there's a post-graduation. Another thing that if you want to do the MRCP, but that's very long, lengthy journey process, and you waste almost 5-10 years and you waste so much money. The cheapest and the best route for anyone who wants to, a doctor who is a doctor and wants to work in the UK as a doctor, is the PLAB test. You can do it within 9 to 12 months and you'll be working. Yes, once you have got the GMC registration, you start working. And once you learn the system, because you're coming into different system, different country, different rules, different guidelines. And if you become familiar to the things, that time your experience, your skills could matter. That time your consultant, your supervisor, you could speak to them. Yes, I've got 20 years of experience in Pakistan and I'm competent. I have shown in 6 months that I am. Then you can get promotion from SHO to registrar. And then if you want to do FCPS, MRCP, and then you can become consultant as well. But that will help you to move forward on the ladder quickly. because of your experience.
But,
But first,
but the
first,
entry, but the entry required PLAB exam, huh? To enter in the UK.
definitely, yeah. To get the GMC registration, PLAB is the only route.
Okay, and what is your experience like now? The basic, my basic sciences are definitely not too much good because I am now a subject specialist. So is it easy for me to start with PLAB 1 to return back to patho, physio, cardio like this?
No problem at all. Either you have a gap of 10 years or 20 years. This is here we stand. We will be standing with you, and we will, to the point, to the topic, will prepare you related to the PLAB 1 so that you could pass your PLAB 1. So what you need to do, if really first most important thing is that you need to make a decision. Do I need to do it? Once you have decided, yes, I want to do it. Next step is IELTS or OET and PLAB 1. So I usually recommend that if you want to do it, register both for together, because it will save you time and you can kill two birds with one stone. Like once you're preparing for the IELTS and Sam register for the PLAB 1, that will help you to pass IELTS or OET and PLAB 1. Once you have passed your IELTS, half of the PLAB 1, you'll be ready for it. Why? In PLAB 1, when you're starting, you will have interaction with the international doctors from all over the world. When you're taking classes, when you're watching videos, when you're communicating with NHS consultants, that will help you to improve your reading, writing, listening, and speaking. And what you are preparing in IELTS English test, same things. So you can prepare both very well. So you won't be wasting any time or money. In 1 month, once you complete your IELTS or OET course and you do your exam, half of the PLAB course you would have covered. So that will speed up your process and journey. So don't worry, either your basic sciences are weak or anything, we will teach you. We are here, we will help you, provide full support and guidance to pass your exam.
Okay, thank you very much.
No worries. Over
Thank
to you,
so
Dr.
much,
Umar.
Dr. Shakil. We have many more questions, but we will add all the questions at the end.
Thank you
Let
so
us
much.
complete the
Over to
class,
you,
and
Ahmed.
after
Thank
that
you.
we will take the other questions.
Thank you, Dr. Shakil. Thank you, Sana. Okay, so
over to you, Dr.
yes, thank you. So we're gonna go through 2 more questions now, just to give you guys an idea or a flavor of what the single best answers are like. So I'll very quickly read the question, and then you guys can have a think about what the answer is, and then we'll discuss the answer. So you review a 43-year-old man with a history of polyuria, polydipsia, and weight loss. You suspect a diagnosis of type 2 diabetes mellitus. What is the single result that is most consistent with the diagnosis of diabetes? A random plasma glucose of 10.5, a fasting plasma glucose of 6.5, a 2-hour OGTT glucose of 7.5, a HbA1c of 50 millimoles per mole, or a HbA1c of 6.2%. Okay, so I will give you guys 30 seconds. I don't think that was an answer to the question. Does anybody want to volunteer an answer?
Dr. Umar, it's in my opinion, it's D. HbA1c is more than 50 mole per.
Okay, thank you very much. Right, so sorry. Yes, yeah.
Dr. Hina said it's C.
Is C? Okay.
Yes.
Okay. Okay. Any other suggestions? Okay. Sorry, who was the first doctor who asked the question? Who gave the answer? Sorry.
Yasser.
Dr. Saima Yasser. And the second one?
Dr. Hina Zubair.
Okay. Thank you both for your answers. So the correct answer is D. It's a HbA1c of 50 millimoles per mole. So this is a good example of a question which requires actually, I'm sure HbA1c, you guys can tell me if I'm correct or not, should be being used in Pakistan, but it's normal practice now for HbA1c to be used for diagnosis and monitoring of diabetes, and this has been the case for over 10 years now. So a HbA1c of above 48 millimoles per mole is diagnostic of diabetes. The other suggestions, so the other ones were a random plasma glucose, a fasting plasma glucose, the figures that were given, and a 2-hour plasma glucose after OGTT, the figures that were actually given did not meet diagnostic criteria for diabetes. So the only correct one was HbA1c. Next question. So a 60-year-old woman is reviewed 3 days after an MI. She is feeling very breathless. And on examination, you will hear a loud pansystolic murmur, forgive me, which is loudest at the left sternal edge. What is the single most likely diagnosis? Mitral regurg, mitral stenosis, VSD, tricuspid stenosis, or Dressler syndrome? Okay, guys, please volunteer your answer.
Mitral stenosis, B.
Okay, and why do you say that? Was that Dr. Saima? Dr. Saima Yasser? Okay, anybody else support the answer or something different? Or please give a reason. Try to give a rationale, because this is how you have to think in your head. Why is it the case?
Dr. Hina Zubair is saying it's B.
Mitral stenosis, okay.
Any other question?
Anybody
please?
else? Okay, Dr. Hina, why do you think it's B? Please don't be shy.
Because the mitral stenosis patient have a pansystolic murmur.
Okay, okay, thank you. Anybody else? Any other suggestions? Okay, no problem. Let's move to the answer. So
it
the
is
correct
VSD actually, left sternal border. It's VSD, mitral stenosis. Mitral murmurs will be at apex.
Okay, is this Dr. Shahid?
Yes, sir. Yes, sir.
Oh, yes, I recognize your voice from the feedback. Thank you very much. Okay, so the correct answer is VSD. Very well done, Dr. Shahid. Post-MI, VSD, ventricular septal defect, is a rare but serious complication. And this is what I was saying about you have to put yourself in the scenario. So the doctor who kindly volunteered the answer for mitral stenosis, maybe you only focused on what it was saying regarding the clinical finding. So this is what I was saying about reading the question, highlighting, trying to notice what it's saying. This is 3 days after an MI, and she's feeling acutely breathless. So you have to know the complications after an MI, even if they are rare. For example, let's just go through a couple of them.
Can I add another point?
Yes.
Can I add another point? MS will not have pansystolic murmur. MR will have, and VSD. And the location is different. MR will be at apex, and the VSD will be left sternal border.
Excellent. Thank you very much, Dr. Shahid. Okay, so Dressler syndrome, for example. Dressler syndrome, as you know, type of pericarditis, but that won't develop for maybe 2 weeks, maybe a few weeks after an MI or cardiac surgery. And as Dr. Shahid kindly volunteered, some other clinical knowledge regarding these cardiac conditions and how the murmurs present is key. So as you can see, the question is very focused and very specific, but you need the knowledge about what happens after an MI. You have to be able to apply that knowledge, and then you have to be able to apply the knowledge you already have about certain murmurs, certain conditions, what they actually fit with. Thank you. Let's move on to the next question. A 76-year-old woman with poorly controlled hypertension develops sudden visual loss in her right eye. Visual acuity on the right is reduced to hand movements only. So this is suddenly the vision is reduced significantly. Visual acuity on the left is 6.6. On examining her fundi, you notice engorgement of the retinal veins, disc edema, multiple flame-shaped hemorrhages, and cotton wool spread across the entire retina. What is the single most likely diagnosis? Central retinal vein occlusion, vitreous hemorrhage, central retinal artery occlusion, diabetic maculopathy, or wet age-related macular degeneration? Please volunteer your answers.
Not confirmed, but it's a vitreous hemorrhage because there is a hemorrhagic sign, redness and flame-like appearance.
Thank you. Anybody else? Don't be shy, guys. Be brave.
Dr. Umar, we have got a answer from Dr. Farzana. She's saying it's A.
Central retinal vein occlusion. Okay. Thank you, Dr. Farzana. Somebody said B. Yes, Dr. Hina Zubair said B. Dr. Farzana, please could you explain your rationale as to why you think it is A? Please come on the mic.
Hello, it's Farzana here.
Yes,
Basically,
Dr.
I read it. Yes, I read before that the central retinal vein occlusion and with the diabetes and the hypertension, and the patient is 67 years old, and main point is the visual acuity on the left side is 6/6, and the visual loss, sudden visual loss. These are the these are the main points on which we are.
Thank you, Dr. Farzana.
Thank you. Thank you.
Okay, so the correct answer is central retinal vein occlusion. Well done, Dr. Farzana. So you're right, this causes painless unilateral visual loss. And this is a characteristic appearance of what has been described in the question, what is otherwise known as a pizza thrown against a wall. That is how it looks. So the other conditions, central retinal artery occlusion, also presents with painless unilateral visual loss, but the appearance of the retina is different. You get the pale retina, and you get attenuation of the vessels, and sometimes you get a cherry red spot. So vitreous hemorrhage occurs when there is bleeding in the chamber of the eye, and this results from usually from trauma or retinal detachment, and the appearance is different. The appearance is like blood inside a gel. Blood within a bloodless gel is how it's described. So so these are just a few examples of why the other answers are not appropriate, but why central retinal vein occlusion is most appropriate. Thank you. Just 2 more questions left. Okay, so next question. A 62-year-old female smoker presents with weight loss, dysphagia, and intermittent vomiting. On examination, you notice a mass in the left iliac fossa. An ultrasound scan demonstrates bilateral solid ovarian masses with clear, well-defined margins. What is the most likely underlying diagnosis? Now, nothing is worded accidentally in these questions, so you have to take care over noticing and understanding why certain words are used. So the options are primary ovarian cancer, carcinoma, esophageal cancer, gastric cancer, benign ovarian tumor, or functional ovarian cysts. So, please, what do you guys think? Any gynecologists or gastroenterology doctors?
Not confirmed,
present?
but it's esophageal carcinoma.
Esophageal carcinoma, did you say?
Yes.
Okay, and why do you say that, please?
Because the causes which he mentioned that it's related to the ovarian mass, but sometimes it not causes the weight loss or dysphagia or intermittent vomiting. The patient has a history of dysphagia, intermittent vomiting, and the weight loss.
Okay, thank you. Is it who's speaking, please? Dr. Saima, is it?
Dr. Simon.
Okay, thank you. Anybody else? Any alternative suggestions, please?
Dr. Hina is saying it's A.
Okay, primary ovarian carcinoma. Okay, thank you. I think because of this ovarian masses. What? Okay, somebody else also said esophageal carcinoma. Okay, right. Let's have a look at what the answer is. Thank you. Yeah. So the correct answer is gastric carcinoma. Now, let me just take you back to the scenario. So 62-year-old female who's a smoker. So she presents with weight loss, dysphagia, and intermittent vomiting. Now, the first thing I would say is when you read these symptoms, are you thinking gynecological cancer or are you thinking gastroenterological cancer? I would suggest that you should be thinking gastroenterological cancer, whether it's esophageal carcinoma or whether it's gastric carcinoma. Okay. However, on examination, the patient has some masses in the ovaries. So what has happened here? So what has actually happened is that these ovarian masses are a metastasis from a primary site. This is called a Krukenberg tumor. Okay, the commonest cause is a gastric carcinoma, but these can also come from colorectal, breast, lung, other carcinoma sites. So the key is the first bit. What is the presenting complaint? And then in the second bit, you will see that the ultrasound reveals solid, well-defined ovarian mass, which is bilateral. That is also a key point. Okay, and it's well defined, and it's on both sides. So this is quite a difficult question, I think, and I think that came across in the answers. So again, the key point is noticing the important pieces of information in the scenario, and then trying to piece it together and eliminating the answers. Okay. The final question. This should be much more straightforward, hopefully. I'm guessing, especially for guys from the subcontinent. So, a 44-year-old businessman returns from a trip to West Africa with headaches and intermittent fever. Thick and thin films are sent to the lab and a diagnosis is made of malaria. The patient is started on treatment, but their condition deteriorates and he develops jaundice, renal failure, and hemoglobinuria. What is the single most likely causative organism of his presentation? So please, guys, this is the final question. Somebody else, can we have somebody different to Dr. Saima, Dr. Fazana, Dr. Shahid, somebody new? There are 21 people in the group. Please don't be shy.
Dr. Umar, it's a falciparum.
Dr. Saima again, thank you very much. Anybody else?
Dr. Farzana is saying it's A.
Yeah, okay. One more for look. Dr. Hina Zubair again. Okay. Also saying A. Excellent. Thank you very much, guys. And let's have a look at the answer. The correct answer is A. Plasmodium falciparum. Right. So I expected that you guys would do well in this question. Obviously, you guys probably know a fair bit more about malaria than some other places. Most commonly caused by falciparum, but in particular, I want you to take notice of two things. So first is obviously the the initial presentation is completely consistent with malaria, headaches, intermittent fevers, and of course, you're told in the answer that malaria is the diagnosis. The second thing, though, is the patient deteriorates and develops jaundice, renal failure, and hemoglobinuria. That is what the question is telling you, is not by accident. It's there because it's for a reason. And this particular presentation, particularly the hemoglobinuria and renal failure, after treatment is most suggestive of black water fever, which is caused by falciparum. And this is a reaction between parasite and quinine causing hemolysis. So very well done, guys. That was just a few questions just to give you an idea of just a flavor. And obviously, we need to do much more mock questions. We need to do hundreds and hundreds, if not even thousands. So excellent, very well done, guys, especially the most vocal of our colleagues who were brave in suggesting the answers. So I'm very briefly going to summarize what we've done today, and then I think most of the questions are more suited towards Dr. Shakil, who is our CEO, and he's the expert in the PLAB process. So I'm just very briefly going to summarize. Planning and preparation is key. No matter what stage you are at, no matter what stage of your career, your clinical competence, or your confidence, or if you've had a break or whatever, you need to plan and you need to prepare. And we are here to help you and support you every single step of the way. Use the recommended resources. I've posted all the links to PLAB Blueprint, to the foundation year curriculum, to clinical knowledge summaries, NICE guidance, and the BNF. Have a look at these, familiarize yourself with them, and start to think about where you are in relation to where the GMC want you to be. Good medical practice. This is a document that it will be, I think it will be fairly novel for you guys, fairly new, but it's again another important GMC document for you to take a look at. It just takes a quick search on the GMC website, Good Medical Practice, lists a whole host of things, which is the GMC's view on how doctors should practice medicine, professional values, ethics, safeguarding, teamwork, integrity, etc. And the duties of a doctor is also a similar set of values that are important for you to be aware of. We mentioned the PDSA cycle, Plan, Do, Study, Act, which in relation to exams, I would change to plan, revise, practice, and then analyze. Practice, practice, practice with any kind of examination, whether it's MCQ or OSCE style, which we will talk about in the future. Practice is the key. Theoretical knowledge won't get you very far. You have to be able to apply the knowledge. This is just the beginning. This is the first of many sessions to come, inshallah, on PLAB and specifically on certain topics. There will be live face-to-face teaching. We will guide you every single step of the way, as Dr. Shakil has said. And Dr. Shakil very kindly has already mentioned UKMLA, which I was going to do here, but I don't need to now. It's not something that you need to be worried about, or even but just be aware of it, that it's basically going to be a bit of a name change, essentially. The basic principles and requirements are not going to change much. There may be some change, but it's not going to change much. And UKMLA will also not be just for you guys, for international graduates. It will be for anyone who wants to practice medicine in the UK. So even medical graduates in the UK will have to sit the UKMLA. And it will be brought in line, and PLAB will be brought in line with this. So I'm just going to leave this slide here. and I will hand over to Sana and Dr. Shakil, if he's still here, to tidy up on any questions that are outstanding.
Yes, thank you, Dr. Umar. We have some questions, and I think it's the end of the session, so we should entertain that questions. And let me just
Yes.
repeat the questions. We have got a question, like we have got few questions from what documentation needed to complete before applying for booking PLAB 1.
Okay. Yes, Sana, are you able to help with this question, as I am less familiar with the administrative side of
Yes,
things?
yes.
Please.
Let me give you the answer.
Yes, please.
You just need to have a medical graduate, and you must have a passport. Otherwise you don't need any other document. We are here to prepare all your documentation for the PLAB 1.
Excellent.
The second question is booking easy or difficult, as nowadays it's hearing that it's overcrowded. Yes, bookings are difficult, but as for the November, you can't like book a date till now, but for the February, you can definitely book your seat easily. Don't worry about it. We will help you with that. How much time it takes to book PLAB 1 and payment? I think you're asking about the preparation or the booking. For the preparation, as Dr. Umar already told you that you might need to prepare for like 4 to 5 months, and after that you will be able to sit in a PLAB 1 exam. And for the booking, you just need to check the GMC, and we will definitely help you in the booking, and we will let you know when you need to book your PLAB 1.
Brilliant.
Any other question, please?
So,
Hello, can you hear me?
yes,
sure,
we can hear you.
Yeah, I have a question. Actually, I'm not a doctor. I was only attending this on behalf of my wife, who is a doctor. But since she is working, she could not attend. So my question was, will we be getting the link to this screen recording or not, so that we can review it later?
Yes, sure. Don't worry. We will share. You just need to share the details with us.
Okay, sure. Thank you.
Excellent. So Dr. Hina is asking, do we deal
Thank
with
you.
the Australian AMC? I'm not aware that at the moment we deal with the Australian Medical Council. Sana?
Dr. Hina, not yet, but definitely you can contact with our team. We will let you know about the details.
Yeah.
You can see the below message. We have all the contact details. You can contact with our team. Our team will let you know about the details. Don't worry.
Okay. Can I just highlight to everyone who's still in the session that we will very much value your feedback. I will get the team to post a link in the chat as well as in the WhatsApp group. And please be honest, it's a learning experience for everyone, and we want to continue to improve. Nobody is perfect. No organization is perfect. We try our best, and we will try our best to take on board your feedback, comments, and try to improve the sessions. Sana, if there's no other questions, can we?
We have one.
Yes,
Yeah, sure.
please.
Is doing a house job in anesthesia or in any other rotation is worth it when it comes to clinical experience and applying in foreign CV or other part of it?
So I'm sorry, I didn't catch your name.
Dr. Afraz.
Dr. Afraz. Okay, thank you for the question, Dr. Afraz. So if I've understood your question correctly, I think what you're saying is there a benefit to applying for anesthesiology in a house job when it comes to CV and experience? Is that correct? Is that what you're saying?
But like it has some area of being corrected. Like if a person does house job in anesthesia, house job, like some areas of rotation of house job were acceptable there in the UK in the past. I don't know right now.
Okay. Well, let's just go back a little bit just to clarify. All the minimum requirement for sitting PLAB 1 is medical is graduation from a validated medical school in Pakistan. That's all you need. You don't even need house job. You don't even need beyond house job. So any house jobs and rotations that you do will be good for your clinical experience and your CV in the future, and of course preparing you for practice when you come to the UK. But in order to just sit PLAB, you only need a minimum to be a medical graduate. Anesthesiology is an excellent specialty, is an excellent rotation. There are many acute skills you learn. It's brilliant for getting you very confident with managing emergencies. So it's an excellent rotation. I would very much encourage you to do anesthesiology, especially if you are interested in any type of acute or emergency medicine. But specifically for PLAB, it does not matter. I hope that answers the question.
Okay, sir. Thank you.
Thank you.
We have a previous question from Dr. Saima Yasser. She's asking,
Yes.
any other book will need with your course, or your course is enough for pass? Don't worry, Dr. Saima. We have a complete package that is all in one package.
Sir,
And,
I have one question.
sir, let me just finish. After that, we will add your question. Don't worry. So you don't need to buy any material from outside. We will prepare you
I
for
have
the
one
complete
question.
Dr. Hikmatullah, please, are you able to just wait for 10 seconds while Sana just finishes the answer to the previous question? Can you hear us?
Yes, sir.
Okay, please just hold on 10 seconds, please.
Thank you so much. Thank you, Dr. Omar. So I was just letting Dr. Saima that she's asking that any other material she'll need from outside. Don't worry, Dr. Saima, we are here with all in one package, and we will give you all the material, grammar courses, audio video sessions, and mock exams. You don't need to buy anything from outside. We will prepare you, and we will give you all the study materials. Dr. Hikmatullah, you can ask your question now.
Yes, I only have these questions that how many persons do you have to pass in PLAB 1 exam? If the sir tell me clear about this.
Okay, so Dr. Hikmatullah, there is no such, as far as I'm aware, Dr. Shakil is not here, but as far as I'm aware, there's no such set pass mark for PLAB, or to be honest, for any medical examinations in the UK, and I suspect it will be the same in Pakistan also, in any country. It depends on how the group does on the day. So obviously, the pass mark varies from year to year, but you should not focus or worry about the pass mark. All you need to focus on, all you need to worry about is your preparation. And in order to help your preparation, that's what we are here for. We are here to get you best prepared as possible to sit the examination. Don't focus on what the pass mark will be, because that varies from year to year. Just focus on preparing yourself as best as possible and just following the guidance that we give you. I hope that answers the question.
Yes, sir. Thank you, sir. Thank you.
Thank you.
Thank you so much, Dr. Fazana. We have a feedback from Dr. Fazana. Very informative session. Thank you, Dr. Omar.
Thank you, Dr. Fazana.